Hi everyone, it's Win Brown, Wednesday, June 24th, here for our Haywood Healthcare COVID-19 update. I just want to give a little shout out to the puppies. People just today said, where are your dogs? So there's one dog. Finny, can you come over here, Finny? Come say hi. I'm trying to say hi. There he is. There he is. Anyway, so I know everybody loves a dog, so just a little shout out to Finn and Fred so that they can grace our video today. I'll take a look. It might not have been the best shooting that I've done. So anyway, just a quick peek at the dogs. Let's get right to our testing. June 24th, we have tested 7,590 individuals, 1,602 negative results, 512 positive, 78 indeterminate. So we've inched up one indeterminate after a few weeks. Our 10-day rolling average of positive is down to 0.59%. Good job, community. And the state 7-day average is at 1.9. Since the beginning of the pandemic, we're at 6.8 cumulative versus the state at 10.8. Worcester County, 12,192 COVID-19 cases so far, and Franklin County is at 359. So I just want to follow up on the governor, recently moved us into phase two as a part two of phase two. And so that allows indoor dining, close personal contact services with certain restrictions, retail dressing rooms by appointment, offices at 50% capacity. And so while this is all exciting and we are moving forward, I just want everybody to look to the south and to some of the other states that are seeing resurgence of their COVID-19 diagnoses. And so we really need to keep this tamped down locally. So continue socially distancing, wearing your mask, washing your hands, doing those kinds of things so that we remain healthy, your health system remains healthy. We have progressively gotten busier, which is fantastic. We have an incredibly strong OR day today on the Haywood campus, and so we need to keep doing those things. So just to also let you know that we are adjusting our protocols on our campus as we look at things, including our visitor policy. So effective Monday the 29th, all patients may have one healthy visitor with them, and they will be all screened as they come in for symptoms, just like we do for everyone entering. However, if you are an inpatient and you are diagnosed positive for COVID-19 or a patient under investigation, you cannot have a visitor. So that just let the staff and the community know that those patients cannot have a visitor at this time, unless it's an end-of-life issue for a patient. Then we will allow them to have a visitor or visitors so that family can be with them. But just to let you know that is the caveat to that. So, we have to keep our social distancing guidance in place and everything as well. We're going to allow that in our ERs as well. So both ERs, on a case-by-case basis, we will allow each person coming into the ERs to have a visitor as well. Again, there may be extenuating circumstances where that does not happen, or there might be times when if the visitor might be asked to step out of the room when exams and things are going on as well. We're also changing up our visiting hours, and so we are going to have visiting hours on both hospital campuses from 11 a.m. to 7 p.m. For inpatient visitation. That is a little bit different for our maternity unit on the Haywood campus, and if you are there and having a baby, we'll share those visiting hours with you, but they are much more liberal, as you can imagine, for the one family member that can be with them. We're going to have security at each entrance, and we were looking to open up our south entrance on the Haywood campus as soon as we can. We've been hiring staff and getting people trained up. I just ask, especially our visitors who see this to our campus or coming for an appointment, please arrive on time, maybe a little bit early, and just be patient. It takes time. A lot of patients need to be transported, and I know it can seem as an inconvenience, but we're doing it for everyone's safety and well-being. So I appreciate your thinking of that as you come to our campuses. Cafeteria changes for staff. Obviously, we put some sneeze guards in place, and we continue to provide free meals at both cafeterias. We're going to be doing that through July 6th. July 6th, we will go back to staff paying for their meals, where we're just following really the governor's reopening, and says dining rooms are reopening. We are going to be doing that as well. Our dining rooms will not be open to the general public just yet. Again, we're going to see what our volume looks like, what our capacity is, and make sure that we can handle that from a capacity perspective. So no general public in our cafeterias yet. Haywood Strong Apparel is, as you know, is back up for sale. It started last week. We've already sold $2,300 of Haywood and Athol Strong, and there's a link with this email if you want to get that in your wardrobe. We'd love to see more of that. Also, I talked a little bit about our Watkins Faust annual golf tournament for Haywood Hospital. That is going on in a revised virtual format. You'll be playing between August 3 and October 13th. We have new sponsors, Wood Ambulance and the returning foursome of Team Stromsky, which is one of our long-standing family teams, and we'd love to have them back. Their parents were incredible, and grandparents were incredible supporters of Haywood over the years. So please go to haywood.org/Haywood Golf. Registration closes the 20th of July for that. And just some thank yous. First to Ken Tomasetti. You hear his name a lot. You know, he owns ACT, Advanced Cable Ties, in our community. And again, he used his own personal vehicle to provide 125 food bags to Winchendon today. So he is just a great community hero, and we appreciate what he does and all his staff. I toured his facility yesterday, and that is just an amazing factory. And the work and space that they've put out to make sure that we have food security for our community is incredible. So thank you to you and your staff for that. Our door screeners and security teams got meals this week from folks who have donated to the Gardner Ale House Community gift card. So thank you for that. And West Broadway Pizza, thank you for lunch at Meeting House Family Medicine, Family Practice. They've been providing meals since the beginning of the pandemic. So thank you for that. And a shout out, EVS shout out that came in on Facebook. So just to share some community feedback, a community member writes, I had the opportunity to visit our hospital a few days ago. Not only was I impressed how clean and sanitized it was, but I felt extremely safe being there. Please note I'm both proud of my hospital. I am both proud of my hospital, and please keep up the great work and all the care that you do for our community. So thank you for that. And a shout out in the Athol region to Bill Kessler of Kessler Investments, who's a great supporter of the community and of the hospital there, and Hannaford Supermarkets. Hannaford gave him a bunch of reusable bags, and he filled them with snacks, hand sanitizers, and other items for the CNAs and RNs at Athol Hospital. So thank you, Bill. Great shout out for all you're doing. So, and I thank all of you for all you're doing to be safe out there, to support your community health system as we continue our journey to be one of the best community-owned health systems in America. Have a great day.